Look at someone's eyes right now. Your own in the mirror, a loved one sitting across from you. And I want you to understand something that took me years of clinical practice to fully appreciate. Those eyes aren't just how you see the world. They are one of the most honest windows into what's happening deep inside your body, often long before any other symptom shows up. I've seen patients come in for an eye complaint and walk out with a diagnosis they never expected. Thyroid disease, diabetes, dangerously high blood pressure, even early-stage cancer. Not because the eye itself was sick, but because the body was trying to tell us something, and the eye was the loudest messenger in the room. So today, I want to walk you through the signs that I look for, the ones that genuinely matter, and explain in plain, simple language what each one could mean. No medical jargon, no unnecessary scare tactics, just the real information you deserve to have. Because knowing these signs could genuinely change your life, or someone else's. The whites of your eyes are telling a story. Start with the whites, the sclera, as we call it in medicine. In a healthy person, they should be bright white, clean, clear. The moment they start changing color, your body is waving a flag. The most dramatic change is when the whites turn yellow. This is called jaundice, and it means one thing. Bilirubin, a yellow pigment produced when old red blood cells break down, is building up in your bloodstream instead of being processed and removed. Your liver is supposed to handle that job. So yellow eyes almost always point back to the liver. Liver disease, hepatitis, cirrhosis, bile duct blockages, or, in some cases, a condition called hemolytic anemia, where your red blood cells are being destroyed too fast for the liver to keep up. Here's the important thing about yellowing in the eyes specifically. The eyes often show it before the skin does. The sclera has a natural affinity for bilirubin. So if you notice your eyes looking a little yellow, even slightly, especially combined with any fatigue or dark-colored urine, please don't wait. That is a signal worth taking seriously and getting checked immediately. Now, a slightly different situation. If you notice a yellowish, slightly raised growth on the white of your eye, near the colored part, that's called a pinguecula. It's very common, often harmless, usually caused by UV light exposure, wind, or dust over years. It looks alarming, but it's generally not dangerous. It just means your eye has been exposed to the elements for a long time without much protection. Sunglasses help prevent it from progressing. What about red or bloodshot eyes? Most of the time, this is benign. Dryness, allergies, a late night, too much screen time. The tiny blood vessels on the surface of the eye get irritated and dilate. Easy fix, not a concern. But there's a specific type of redness that is very different. It's called a subconjunctival hemorrhage. A sudden, painless, bright red patch that looks like someone spilled red paint on the white of your eye. It's actually a small blood vessel that burst. Usually harmless on its own, caused by sneezing, straining, or rubbing. But if it happens repeatedly, without any obvious trigger, that can be a sign of uncontrolled high blood pressure. Your blood pressure is literally bursting tiny vessels in your eye. That is worth investigating. Your eyelids know more than you think. Most people never really study their eyelids, but I do, because the eyelids carry some of the most underappreciated diagnostic clues in all of medicine. Let's talk about xanthelasma first. These are small, soft, yellowish plaques, flat or slightly raised, that appear on the eyelids, usually near the inner corners. They're deposits of cholesterol under the skin. Now, interestingly, not everyone who has xanthelasma has high cholesterol. Some studies suggest up to half of patients with these plaques have normal lipid levels. But a significant portion do have elevated LDL, elevated triglycerides, or an underlying lipid disorder. If you see these on your eyelids or someone else's, it's worth getting a full cholesterol panel done. It's painless, it's cheap, and the information it gives you about your cardiovascular risk is extremely valuable. Now let's talk about drooping eyelids, what doctors call ptosis. There's the kind that comes with age, where the muscle that lifts the eyelid just weakens gradually over years. That's generally cosmetic. But then there's ptosis that appears suddenly, or appears on just one side, or appears alongside other symptoms like double vision, weakness in the face, or difficulty swallowing. That combination is neurological until proven otherwise. It could signal a stroke, a brain aneurysm, myasthenia gravis, an autoimmune condition that attacks the nerves controlling muscles, or a condition called Horner's syndrome, which can sometimes be caused by a lung tumor pressing on a nerve pathway that runs up to the eye. I want to say that again clearly. A drooping eyelid that appears suddenly, especially with other symptoms, is a potential emergency. Don't dismiss it. Don't wait and see. Get evaluated. On the other end of the spectrum, eyelids that retract and pull back, making the eyes look unusually wide and staring. That's a classic sign of hyperthyroidism, specifically Graves' disease. The thyroid gland is overactive, and one of the ways this expresses itself is through eye changes, including lid retraction, a feeling of pressure behind the eyes, and sometimes the eyes actually protrude forward. If someone looks like their eyes are perpetually surprised or a little bulging, thyroid function tests belong in the workup. The pupils, the windows behind the windows. Your pupils are controlled by your autonomic nervous system, the part that runs automatically without conscious thought. When everything is working properly, your pupils react the same way at the same speed. When something goes wrong in the brain or nervous system, the pupils often reveal it immediately. Unequal pupils, where one is bigger than the other, is called anisocoria. Here's the thing. A small percentage of people naturally have slightly unequal pupils and always have. That's totally fine. The warning sign is when it's new. When you notice that one pupil is suddenly larger than the other, especially if that person also has a headache, sensitivity to light, nausea, or any change in consciousness, that is a potential sign of increased pressure inside the skull or a brain bleed. This is a 911 situation. What about pupils that are extremely small? Pinpoint pupils. In a bright room, your pupils naturally constrict. But if they're tiny, regardless of lighting, and the person seems extremely sedated or unresponsive, that pattern is a classic sign of opioid overdose. It's a specific and important clinical sign that can prompt life-saving intervention. Conversely, very large, dilated pupils in dim light are normal. But dilated pupils in a bright environment, combined with confusion, flushing, or a racing heart, can point toward certain drug effects or poisoning, including a class of medications called anticholinergics, which are actually present in some common over-the-counter drugs. And then there's something called an RAPD, a relative afferent pupillary defect, which is tested by swinging a light back and forth between the eyes. In a healthy person, both pupils constrict equally when light hits either eye. In someone with an RAPD, one pupil paradoxically dilates when the light swings to that eye. This tells us there's a problem with the optic nerve on that side, possibly optic neuritis, which can be an early sign of multiple sclerosis, or damage from glaucoma, or a tumor pressing on the optic nerve. It's one of the subtler signs, but a skilled clinician catches it immediately. Changes in vision that aren't about your glasses prescription. I want to talk about vision changes that go beyond needing a stronger lens prescription, because these are the ones people sometimes write off for too long. Sudden vision loss in one eye, even temporary, even for just a few minutes, is something I treat with extreme urgency every single time. There is a condition called amaurosis fugax, which is a temporary loss of vision in one eye, often described as a curtain or shade briefly coming across the eye. It's caused by a tiny clot or piece of plaque temporarily blocking blood flow to the eye. And it is a TIA, a transient ischemic attack, a warning stroke. It tells us that something is forming in the carotid arteries or the heart that can send a larger clot to the brain at any time. Patients who ignore this and don't seek care immediately are at very high risk of a full stroke within days or weeks. If this happens to you or anyone near you, please go to the emergency department that day. Not tomorrow, that day. Another vision change worth understanding is when someone starts seeing flashes of light or a sudden shower of floaters, dark spots or strings drifting across their vision. Some floaters are normal and harmless, caused by tiny bits of gel inside the eye casting shadows on the retina. But a sudden onset of many new floaters, especially with flashes, is a warning sign for a retinal tear or retinal detachment, a situation where the light-sensitive tissue at the back of the eye is pulling away from the wall of the eye. This is fixable if caught early. If left untreated, it leads to permanent vision loss. Same urgent timeline applies. What the back of the eye reveals. Here's something most people don't know. The back of your eye, the retina, is the only place in the entire human body where a doctor can directly look at blood vessels and nerve tissue without surgery or invasive testing. Just a light and a lens. And those vessels tell us an enormous amount about what's happening systemically. In patients with uncontrolled diabetes, the blood vessels of the retina start to change. They become weak, they leak, they form abnormal new vessels that bleed. This is called diabetic retinopathy, and it's the leading cause of blindness in working-age adults. The devastating part is that it often causes no symptoms until the damage is quite advanced. This is exactly why every diabetic patient needs annual eye exams. Not just for vision, but because an eye doctor looking at the retina can see the damage accumulating and intervene before blindness becomes the outcome. High blood pressure does similar things. Over time, elevated blood pressure changes the appearance of the retinal arteries. They become narrower. They start compressing the veins where they cross them. The walls thicken. A trained eye doctor can look at the retina and grade the severity of hypertensive damage. This is another reason controlling blood pressure matters. It's not just about your heart and kidneys. It's literally burning away the blood vessels in your eyes. A few more signs you shouldn't miss. There's one more I need to mention because it comes up more often than people realize, particularly in younger patients. A pale ring around the outer edge of the colored part of the eye, the iris. In people over 60 or so, this is called arcus senilis, and it's a fairly common age-related deposit of lipid. Generally not alarming on its own, but in someone under 45, that same ring, called corneal arcus, can indicate a serious familial lipid disorder called familial hypercholesterolemia, where cholesterol is genetically elevated from birth. People with this condition have dramatically elevated cardiovascular risk starting young, and many don't know they have it. A ring in a young person's eye is a reason for a very thorough metabolic workup. And finally, eye movement itself. When someone's eyes can't move smoothly together, or drift independently, or move in abnormal directions, that tells us the cranial nerves controlling those muscles may be compromised. Diabetes can damage these nerves. Strokes can affect the brain regions that coordinate eye movement. Even B12 deficiency can eventually cause abnormal eye movements if left uncorrected for long enough. The eyes are, in this sense, a readout of the nervous system's integrity. So what should you actually do with all of this? I'm not sharing these signs to frighten you. I'm sharing them because informed people make better decisions faster. And in medicine, time is almost always the critical variable. Here is my simple takeaway for you. Get a proper eye exam at least once every 1 to 2 years. More frequently if you have diabetes, hypertension, or a family history of glaucoma. An eye exam isn't just about updating your glasses, it's a health screening. The back of your eye is a mirror of your cardiovascular and neurological health. If you notice sudden changes, sudden vision loss, sudden onset of floaters and flashes, a suddenly drooping eyelid, unequal pupils, yellow eyes, these are not wait-and-see situations. These are same-day or emergency evaluations. And if you see something more gradual, yellowing that's been creeping in, xanthelasma building up on the eyelid, persistent redness without explanation, those belong in a conversation with your doctor at your next available appointment. Not ignored, not Googled into a spiral, just addressed. Your eyes have been trying to talk to you your whole life. They show up for work every day, quietly reflecting the internal landscape of your health. The least we can do is learn to listen. I'm Dr. Chester, and if this video helped you see something new, in every sense of that word, please share it with someone you care about, a parent, a partner, a friend who's been putting off that eye exam for 3 years. This information belongs with them too. Subscribe if you haven't yet, and I'll see you in the next one.